Hi, my name is Elizabeth Reynolds, and I am a public health research analyst at RTI International. I am the lead author of a collaborative paper entitled Newborn Screening Conditions, Early Intervention and Probability of Developmental Delay. This paper focuses on a study that examines links between two programs, newborn screening and early intervention. Newborn screening is a public health program that screens infants shortly after birth for a panel of rare but treatable medical conditions. While some symptoms may be resolved after early treatment, many children can still experience developmental delays, have health problems, or require ongoing surveillance and management to maintain benefit. Early intervention refers to the services available for children from birth to age 3 through Part C of the Individuals with Disabilities Education Act. These services can include individualized family service plans, speech therapy, occupational therapy, physical therapy, or developmental therapy. To be eligible for early intervention, children must either have a documented developmental delay or an established condition that has a high probability of resulting in developmental delay. Our study had two specific goals. First, we assessed which newborn screening conditions are automatically eligible for early intervention across states. Second, we determined the extent to which each newborn screening condition should be automatically eligible for early intervention because it puts children at a high probability of developmental delay. To determine which conditions were automatically eligible across states, we reviewed each state's early intervention eligibility policy. If a state had an established condition for eligibility, we searched the list for each of the recommended newborn screening conditions. To determine which conditions should be automatically eligible for early intervention, we created a matrix to assess risk of developmental delay, the extent of medical complexity, and the likelihood of episodic decompensation. Two of my co-authors who are medical experts independently classified each condition. These medical experts are both pediatric geneticists with extensive clinical and research experience focusing on metabolic diseases, genetic disorders, and newborn screening. After the initial classification, final classifications were determined based on literature reviews, clinical experiences, and public health utility. Our results demonstrated considerable variability in the extent newborn screening conditions were automatically eligible for early intervention across states. Spinal muscular atrophy was the most frequently included condition, appearing on 29 states' established conditions list. The results from our matrix found that 29 out of 34, or 85%, of recommended newborn screening conditions should be automatically eligible for early intervention. 3 conditions are described in detail, including biotinidase deficiency, severe combined immunodeficiencies, and propionic acidemia. There are limitations that should be noted. Due to limited data tracking across programs, we were unable to know the rates in which children with specific newborn screening conditions are referred to and enrolled in early intervention. Consistent documentation, improved data tracking, and cross-state policies for data sharing are necessary to support future research. In conclusion, many children diagnosed with newborn screening conditions are likely to experience developmental delays and significant medical complexity. We recommend 29 newborn screening conditions should automatically qualify children for early intervention. Our findings suggest the opportunity for newborn screening and early intervention programs to create a consistent set of established conditions that would potentially expedite referrals of eligible children and streamline children's access to early intervention services.